Also, new data reveals that your blood type could be linked to your risk of getting COVID-19 and just how severe your case may be. New at 6 o'clock, NBC4's Patrick Healy reports on new findings, including how gender plays into the risk factor.
COVID can and has been devastating for women, but since early on in the pandemic, it was clear women are less likely than men to contract COVID, less likely to develop severe symptoms, less likely to die.
There's emerging data suggesting two things.
NBC News medical contributor and MD Vin Gupta speaking on the Today Show, citing first data that women as a group have a more sophisticated immune system response to COVID. A Yale study found a more robust T-cell response in women.
Our study shows that men who develop very poor T-cell responses are at risk of progressing to worse disease.
Men are also more prone to the severe inflammatory response that can be more harmful than the infection itself. An additional difference may explain why women are less likely even to catch COVID.
Men tend to have more of an enzyme in the body that facilitates entry of COVID-19 into human body cells versus women. So it's easier to get infected in theory if you're a man, and you also have a worse immune system response.
Other studies indicate slight differences correlated to blood type. Type O less likely to catch COVID. Types O and B less likely to advance to stage requiring a ventilator or dialysis.
But the effect size wasn't even that great. It's not that having type O was very protective. So I think this is intellectually interesting, but ultimately not that actionable.
After all, you cannot change your blood type. Data all show disparate impacts by racial and ethnic and socioeconomic groups. That is something attributed not entirely, but in large part to inequities in access to health care. Now, reducing those disparities is certainly something that is doable. It is a stated priority in the state of California, and test and mortality numbers do show some progress. Reporting live, Patrick Healy, NBC4 News.